Good evening.
Ti vedi, Benito?
Thank you for inviting me to this interesting webinar. I'm going to share with you our experience with COVID-19 in our department, Pediatric Emergency Department. Please, next slide. Okay, as you know, Spain is the country with the highest numbers in confirmed cases of coronavirus, more than 200,000, and deaths, more than 20,000 deaths. Two main focus in Spain, one in Madrid and another one in Catalonia. Please, next slide, please. Please. But only, but less than 2% of confirmed cases are inside the population under 18 years old. Next slide, please. And on the other hand, as has been seen in other countries, the coronavirus disease in children is milder. Few patients are hospitalized in Spain, and only today 2 deaths in all the country have been reported in children under 18 years old. Next slide, please. This is what has happened with the numbers in our pediatric department after the pandemic starts at the end of February, next week of March. The numbers in the number of episodes in our pediatric emergency department go down to the 25% of the number of episodes we attend in this season of the year. And please, the following slide. And as consequence of this picture, our hospital is a tertiary hospital, but it's a general hospital, and we have to share some resources, human resources and material resources with the services for adults. Our hospital was completely transformed in a COVID-19 hospital. There was diversion of human and material resources to care for adult patients, and in our country, in the Basque country, some pediatric departments were closed, and all attendance in primary care and emergency department was concentrated in fewer hospitals. This happened in all regions of Spain. Besides, there was a limitation. There are a limitation to the face-to-face attention. Many of the daily attention to children is making through a telephone or through telemedicine. With this situation, one of the concern we have, and I think in other countries it happens the same, is that we start to have patients with the delayed arrival to the emergency department with some illness not related to COVID-19, as appendicitis, for example, or diabetes. And some of these children come to the emergency department very late in the evolution of this or the illness. For this reason, next slide, please. For this reason, the Spanish Society of Pediatric Emergency Medicine published in the media and in the social network this infography that remembering to the population that they can consult to the emergency department in a safe manner, and with advices when they have to consult in the emergency department or in primary care. The following, please. And I tried to answer the question Ricardo sent me through the email. The first question: how is your pediatric emergency department organized? And the first of the pandemic, the Spanish Society of Pediatric Emergency Medicine published a list of recommendations about how to organize the pediatric emergency department during the pandemic. Next slide, please. The most important is to create two separate patient flows from triage to hospitalization. In two flows, the COVID-19 flow and the non-COVID-19 flow is the most important recommendation from our scientific society. All persons that arrive to the pediatric emergency department must be provided with a surgical mask, the child and one parent for child. And we also give a recommendation about the protection personal equipment. Also, we give some recommendation about treatments and indication to perform PCR. Next, please. Next slide. This is the way we organize our pediatric emergency department. We create two paths: the red path for suspected COVID patients and the green path for non-COVID patients. All unstable patient goes to the resuscitation room, and in this room, all the team is provided with a complete protection personal equipment. The most difficult thing in the beginning was to define which patient goes to the red path, which patient goes to the green path. From the beginning, in the beginning, only patients with fever or respiratory symptoms were located to the red path, but during the pandemic, we have to change this recommendation because nearly every patient with fever, they have a probably focus of the fever were located in the red path. Following, please. Following slide, please.
Yes.
Yes. Okay. The most important thing. One of the objectives of to organize two paths was mainly to protect children and families and professionals from the infection for COVID. And in the red path, all professionals were provided with a complete personal protection equipment with masks, goggles, long sleeve water cone, gloves, and in no COVID-19 flow, the professional wear facial masks and gloves. Next slide, please. How can you define a suspect case of coronavirus infection? I think the definition has been changing during the epidemic. Nowadays, we mainly base our decision to suspect a case in clinical things. And as I mentioned before, we put every patient with fever and other symptoms to the red path, and we protect all the professionals with the complete protection personal equipment. The following slide, please. How do you manage the suspect patient in the emergency department? The Spanish Society of Pediatric Emergency Medicine, with another pediatric scientific societies, published a document about the management of the pediatric COVID patient in the emergency department and in the hospitalization and intensive care. The next slide, please. And we follow this closely, this recommendation. We only practice PCR test patients who are going to be admitted independent of the problem. Not only infectious patient, every patient who is going to be admitted is tested with PCR. Patients with risk factor for poor evolution, with past condition that predispose to worse outcome. And in this patient, when consult in the emergency department with respiratory symptoms of fever, are tested for SARS. Also, neonates with fever, and we consider to practice PCR in some patients with pneumonia with a prolonged course of the illness. The criteria of admit patient have not changed. It's the same that in the regular manner we decide to admit or not a patient. But really, the tense that appears in this slide is not different than our criteria to admit any patient in any moment. Okay. And we give some advice about treatments in the pediatric emergency department, mainly to avoid treatment that generate aerosols like nebulizer or high flow oxygen. Next slide, please. Which patients we practice blood tests or another test, X-ray. We decide the same. We practice a test and image studies patient depending on the clinical status. No different that we decide in the regular time. We also consider to practice ultrasound, mainly in the case we have trained personnel in the emergency department. And the treatment in pediatric emergency department is mainly supportive, avoiding nebulization and high flow, and only in cases we suspect a bacterial infection, and we are waiting. While we are waiting the PCR result, we can start antibiotics, mainly cephalosporin, third generation cephalosporin. This slide, please. And which criteria we use to define a coronavirus infected patient? Clinical criteria and to have a PCR SARS-CoV-2 positive. I think is the same that another speaker has mentioned before. Next slide, please. Next slide, please. And I think for patient healthy, yes, okay. I think I explained before our organization how we separate two paths for the treatment of patient. Next slide, please. We don't have any program to screen parents or caregiver in the emergency department, but we give instruction for testing family members with symptoms in primary care. In the case we admit a patient with positive COVID-19 positive, we start a process that the members of the family are screened, but not in the emergency department, are screened in primary care. Next slide, please. Next slide. And what clinical picture we have? We have few cases and very mild cases. Sometimes I surprised by another numbers in other countries. It's true that, for example, in hospital in Madrid, the number of cases hospitalized and the number of cases of patients in intensive care is higher than in the Basque Country, for example. In our hospital, to give our experience, most patients admitted with tested with SARS PCR are patients with past condition, risk factor for poor evolution, and most of them with mild respiratory symptoms and fever. All of them have a good outcome, and some of them was not hospitalized, only if they have a fever. We have admitted 3 patients with pneumonia, and only one of them was a very worse outcome, but the boy, a 12 years old boy, doesn't need intensive care, didn't need intensive care. We admit one patient with bronchiolitis, and we only admit one patient in intensive care, a patient with transferred from another hospital in the Basque Country, a patient with a toxic shock-like syndrome, similar and with also an SANC-10, similar to the picture that are being described recently in another countries and hospital. This is all I have to tell you. If you want to do some question.
Okay. Benito, thank you very much. There are some one question from Simonetta. Why did you use cephalosporin and not macrolide? This is the first question that I catch on the public.
Excuse me, can you repeat the question?
Okay, why Simonetta, this is a society of SIMEUP, tell you why did you use the cephalosporin in the COVID patient and not macrolide?
No, we use cephalosporin if we should suspect a bacterial infection in the patient, complicated the case, not for treatment COVID. No, okay. we don't use any specific treatment for COVID in the emergency department.
Perfect. Okay. Other question? Altre domande?
I have a question.
Okay.
Aprile.
Franzoni. Okay.
I have a question for all speakers. Do you had some neurological symptoms in these patients or not?
No, in our case, but I think recently has been published a paper that the author described some neurological symptoms associated to COVID infection, mainly in very, very young infants under 3 months old.
Okay, Benito.
Correct. This is Camilo. Yeah, I agree with Javier. We haven't seen a lot of specific encephalitis type picture like have been described. There are cases of patients with acute encephalomyelitis, and there's a good review in a radiological journal in which they correlate MRI imaging with the local involvement in the brain. But as far as I know, here in Washington, D.C., we haven't seen any specifics with that.
Okay. Thank you for one more question. Only one. Go ahead. Only one more question.
Do you want me to answer about the neurological symptoms?
Can you repeat, Amelia? Because I don't see Javier.
No, about neurological symptoms. We had a child with the COVID positive because of her respiratory symptoms, and she has some severe headache, and the exam was like the results of the liquor was like a virus, but the PCR for COVID was negative.
Okay. I have to leave the webinar because I have another webinar with Camilo in only half an hour. Thank you very much for this opportunity to share our experience with you, and I hope we are helpful for all attendees on this very interesting webinar. Thank you, and congratulations, Ricardo, for this initiative. Bye.
Thank you, Benito. Thank you.
Yeah, Ricardo, this is Camilo as well. Yes, like I said before, this is a great thing that you guys are doing. We're learning so much, and all the other UTEM Pediatric Emergency Medicine webinars have been fantastic. And we'll be in touch because I'm sure there's a lot we can do together for this. So thank you again for putting this together and reaching out.
Thank you, Camilo.